If I know some. Uh, wait, am I recording? Right. So, uh, the one that is joined together is a polymer. Okay. Joining it together is polymerization. It's in the same one as last week on page 130, one of the last pages. Polymerization. And breaking it down is depolymerization. Okay, can? Got it? All right. So what is this process polymerization now? Okay, so this one, if you want to draw one, right? Okay, let me teach you how to draw. Basically, all you need to do is, can you see here? Carbon, double bond, carbon, hydrogen, 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 right? All you need to do is this double bond open up to become single bond like that, and then just continue everybody. Everything is the same. Okay? Okay? So this is one. You can draw more than one. Or easier, you can just draw a bracket and write the word N. Can you do the same for here? How do you think it would look like? Exactly the same concept. Draw the polymer. Okay. So same concept. You just put the line, double bond open up, and then here HH, CH3CH. So you just copy the same thing. Just bracket and then put an N. That's it. Okay, so this is monomer. N means many, many, many. Get it? So there's many, 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 many joined together like that. Okay? Can? Okay? Can? Alright. So now we done already. So all done. Finish already lah. Chapter finish already. Okay. Today we start a new chapter. So today we do chapter 10. Chemicals in the health. Oh, you're gonna love this. Medicine. Oh. One, two. So this chapter, this chapter is called Chemicals in Medicine and Health. Okay, so basically you're going to learn about modern medicine, you're going to learn about traditional medicine, you're going to learn about health practitioner, and you're going to learn about things like free radicals and antioxidants. Okay, can? Right, so this is this entire chapter. Okay, now for modern medicine, basically we divide into three types. The three types are analgesic. Have you heard of this before? Analgesic, antibiotic, and psychotherapeutic drugs. Have you heard of this before? Yeah. Okay, analgesic. What do you think it's for? Analgesic is for pain. Give me an example of an analgesic. Yeah. Example of painkiller.
Antibiotics.
Antibiotics is totally different. Panadol. When you take Panadol when you have a headache or no headache?
Headache.
Of course, you take it when you have a headache lah. Okay, so find the page. So your teachers didn't do chromosome at all?
No.
No.
Mm.
Okay. All right. This is almost done already. Lor.
That's good.
Okay. Okay, so you will learn traditional medicine. Okay, traditional medicine, and then you will learn what do you call that? Modern medicine. Traditional medicine is only a few. They will ask you ginger, turmeric, aloe vera, ginger, turmeric, aloe vera, tongkat ali, ginseng. Okay, that's it. Very, very few only. They will only ask you the uses. Okay, and one time they show in one of the exams, they show one entire ginger and ask, what is this used for? Many students panic. It's just used for stomach pain. Lah. You write stomach pain, stomach bloatedness, indigestion, all accepted because it's traditional medicine. Okay, so what traditional medicine is used for, and then modern medicine. Okay, so the three groups there. Okay, yeah. Okay, aloe vera is for what? Skin. Okay, applied to the skin. Ginseng is for maintain good health. Ginger is relieve swelling, bodily pain, and bloatedness. You don't know how to write the word bloatedness, you can write stomach upset or indigestion also can. Okay, hibiscus tea or relieve headache and prevent hair loss. Okay, it's also known to lower blood pressure. Okay, quinine. Quinine is for malaria. Okay, Malaysia we don't use quinine lah. Do you know why? Because we got no malaria. We only have dengue. Dengue and malaria, same concept. Okay, so quinine is specifically to treat malaria. Okay, can? So we don't really have it in Malaysia. So you just need to remember a few. Okay, you don't need to really remember a lot. Okay. Modern medicine, I told you there's now three groups, right? Analgesic, antibiotic, psychotherapeutic. And analgesic is for pain. Panadol is the name of the brand. What is the name of the painkiller?
Paracetamol.
Paracetamol. Okay. Then what about aspirin? So there are three common ones. Paracetamol, aspirin, and codeine. What is aspirin? Okay. I guarantee you, this part, they only ask you three questions. Give an example of painkiller. You write one. Why is aspirin not suitable for children? Aspirin can cause stomach bleeding. Not suitable for children. Aspirin is for adults. Get it? Okay? Codeine is very strong analgesic. When somebody gets stabbed, are they going to give you Panadol? No, they're going to give you morphine. Morphine is one type of codeine. Codeine is very strong painkillers. Okay? So analgesic is for pain. Antibiotic is only to kill bacteria. So 你有 COVID 可以吃 antibiotic 吗？ Will it help?
No.
Because COVID is caused by
Virus.
virus. Okay? Alright? COVID is caused by virus, you cannot. So only antibiotics can kill bacteria. What kind of things cause bacteria?
Dirty food.
No, like what kind of sickness is caused by bacteria?
Flu.
Flu is virus.
Stuffing.
Depends. Stomach pain, sometimes it's a stomach flu, sometimes it's a virus, sometimes it's bacteria. Okay? TB, you know what's TB? 肺痨. They probably all blood come out. The TV show. All of you are vaccinated against TB? Got right? Got vaccine against TB. Okay, this one is bacteria. Okay, when you have pimples, it's bacteria. So sometimes when you have a very bad outbreak, the doctor will actually give you antibiotics. Okay, can. A flu is virus, but a virus can cause secondary bacterial infection. So sometimes doctors still give antibiotics. Okay, can. Which one is the first antibiotic ever discovered? Have you heard of it before? Penicillin. There. Penicillin. Okay? Penicillin. Okay, streptomycin sounds like what? 你们吃过的东西 7-Eleven 有卖的 streptomycin strepsils. So streptomycin 是哪里痛？喉咙痛啊。Streptomycin is a bacteria. It's okay. Streptomycin is a antibiotic to kill bacteria in your throat. Make sense? Okay. Penicillin and streptomycin are all different kinds of antibiotics. The antibiotics come from fungus. You know what's fungus? You know what's fungus?
Mushroom.
Mushroom is one kind of fungus. You know 你的面包坏了是不是有黑黑的那个？that's fungus 啊。Okay, so Fleming, how he discovered penicillin is he was growing the bacteria in a agar. He was growing bacteria here. Then he found out here in the plate that he's growing bacteria, he's growing all the bacteria. Suddenly 有一个洞这边没有 bacteria growing. Why is there no bacteria growing here? And then he realized over there, he left an orange. On the orange got fungus. 已经发霉了。那个 fungus 的 spore fly over here and kill the bacteria. Okay? Last time, 如果你跌倒，伤口很大 okay? They have to cut off your hand. Let's say 啦，很大很大的 they have to amputate your hand. You cut off your hand, you die. You don't cut off your hand, also you die. Why? If you cut off your hand, you will stop the bleeding. But when you cut off your hand, bacteria will go inside your blood and then you die. Okay? Do you know what's appendicitis? Appendix.
Oh,
You know what's appendix? How you call it in Chinese? Appendicitis, the stomach very pain, very pain, very pain, then have to go hospital take it out. What's it called?
Yes.
Yeah, yes, 盲肠, yes, correct. It's actually nothing to do with 吃太饱. It's not 吃太饱.不会的，那个是肚子痛，不会的。Because no, yeah, all fake one, fake one. Okay, your appendix. This is your mouth. This is your stomach. The food is in here for 2 to 3 hours. 吃太饱，那个 food 还在 stomach 里面。Then after that, they go to your small intestines. 6 hours later, they go to your large intestines. 你的盲肠在 large intestines 跟 small intestines 的中间。This is your appendix. 你知道为什么会中盲肠吗？盲肠炎，因为 this appendix is over here. The food is supposed to go this way. 你没有吃水果，你没有喝水，你没有吃菜，you get constipation. When you have constipation, everything inside here, basically all your shit is hard. When it's hard, it can fall inside the appendix and then it will start to get swollen. Okay? So if 你的盲肠发炎, okay, what must you do? Now we go for surgery. Right or not? Of course go for surgery. 以前, if you go for surgery, you die. You don't go for surgery, also you die. If you don't go for surgery, the 盲肠 inside will burst inside and then cause all internal bleeding. If you go for surgery, 开刀拿出来, you inside got bacteria, also you die. So everybody died very, very often. In First World War, all the people who got gunshot wounds, all the soldiers all died because there is no antibiotics. World War II 没有这样多人死，因为 got antibiotics. They have discovered penicillin. So every time you go for surgery, you will get a penicillin shot. So or any antibiotic shot to kill any bacteria that's inside your body. Understand? 你们知道什么是破伤风吗？
Oh,
Okay, how can you get not touch the rust? Again,
hand of eating.
okay, 破伤风 is called tetanus. Tetanus is not 生锈. It doesn't have to be 生锈. That's why don't believe all these old wives' tale. 吃饱饱, 跳跳跳跳跳就会冲往长颜. No, 你吃饱饱, you jump jump jump, it's pain because your stomach is contracting. The food is in your stomach 2 to 3 hours. You don't eat vegetable, don't eat fruits, don't everyday 大便. That is what causes appendicitis. It's when the shit falls inside there. Because it's too, all your internal, all your feces is hardened. Do you know children, when they have stomach pain, 90% is all the feces is stuck in their intestines because they are constipated and all their intestines are swollen. You're supposed to go toilet every single day. You go inside, you're supposed to come out within 5 minutes. If you don't come out within 5 minutes and you have to push and push and push, you're going to get basically like a pimple in your ass. That is called, it's piles. Last time, only old people get piles. Nowadays, teenagers also get piles because they don't go to the toilet. They don't even know how to go to the toilet. You're supposed to go every single day. It's supposed to take you 5 minutes. And I had a friend, I have a friend, right? Her friend, the parents are both pediatrician. So he always thought his parents was something wrong. He's 14 years old. Every day the parents will ask you, you got shit today or not? Your shit come out, what shit? Every day will ask that was something wrong. Then only they realize every single day they have children coming to their clinic with swollen abdomen. It's very, very common. You know, every time 小孩子肚子痛, 肚子痛, 肚子痛. Sometimes you all also 肚子痛. Actually, it's because in your large intestines, you know, right? That's not your stomach. Small intestines are, this is your large intestines. Your large intestines are 6 meters long. No, 4 meters long. Small intestines is 6 meters long. Here is your appendix. If it's not moving smoothly, it gets stuck. And then this is your anus for you to come out, right? If you push and it causes bleeding, you're causing cuts here. Okay? My ex colleague, his son, at 12 years old, 2 weeks, cannot go toilet. When they went and checked, he had third stage colon cancer already. Colon cancer at 12 years old. Because every day they eat junk food lah. Eat Maggi mee, junk food every day. Hey guys, people are dying younger and younger. Your generation, my generation is the generation that is going to be dying younger than our previous generation. Your generation is going to be first generation that is going to die even younger. No, nowadays because got no more modern technology, 人家可以活比较久还是活比较少? Supposedly supposed to 活比较久, right? Nowadays, more and more people are dying younger and younger. Your generation is going to be the first generation that get diabetes and all that at teenagers. You're not, if you drink soft drink every single day, by the time you are 30 years old, you have a liver of a 60-year-old alcoholic. Nice knowing you. Okay, so tetanus 破伤风不是生锈 Okay, next time, right? Let's say 你们给刀 okay, 插到 don't be stupid, okay? It is any puncture wound. Do you know what's a puncture wound? Puncture means it's deep. Okay, now it's caused by a bacteria called Clostridium. Okay, this bacteria 在哪里 Everywhere. 这里有 especially 你的鞋底很多 Okay, 可是你动了不会死的不是动了就破伤风的 Why? When it's on the outside, here's all the Clostridium because I step on the floor ma. Here's all the Clostridium. It's on the outside. Even if I touch it on my skin, it's okay. It's all on the outside. It's only when you get a puncture wound. A puncture wound is deep or not deep? Deep. So when you get a deep wound, what happens is the bacteria can go inside. Inside, they cannot get oxygen. When they cannot get oxygen, they will release something that causes botulism. 你没有听过人家女人打 Botox? 你有听过吗？那些女孩子 打Botox. Have you heard it before? Heard before or not? 打了它这里不能动嘛 because Botox is a chemical that is made by this bacteria. It makes your muscle cannot move. So 你可以笑 like that lah. Alright? So if it is inside your body, if it's inside your body, it will cause your muscles inside to die and then you get 破伤风 and die. So every time there's a puncture wound, you go and get a tetanus shot. Tetanus is a type of bacteria antibiotic to kill off the bacteria inside your blood. Understand? Okay? So, next time if ever you get cut, don't say, 没有生锈不会死的. And then next time, 哎呀，吃了不要跳跳跳 after you get 麻疮. Okay, no, 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 no. Incorrect, right? So all of it comes from fungus. Okay, so 老师是不是这样哦？那个面包发霉了，我可以吃那个 fungus? No, because that's a different strain of fungus. Understand? Okay? Okay, so analgesic is for pain. Antibiotic is for kill bacteria only. Psychotherapeutic, okay, please don't go and say psychotherapeutic is for orang gila. No. Psychotherapeutic is for psychiatric patients. Okay? Psychiatric means mental illness, not orang gila. Okay? Now, there are 3 types. Stimulant, antidepressant, antipsychotic. Stimulant is very sleepy. Take stimulant. There's stimulant. Like what? Coffee. Coffee is a stimulant. Red Bull. Red Bull is called you know what they call Red Bull? Do you know what the lorry drivers call Red Bull? They call it cut leg drink.
Sweet.
It's not only sweet, it has a lot of caffeine.
Ketuk. 他这个1小时有问题，我问题是10个小时，
Okay.
下来太离谱。
Alright, so the lorry drivers, they drive from, let's say, KL all the way up to Penang. Then they want to come back. Correct or not? The more trips they make more money, right? Correct or not? Okay, the more trips they make more money. Okay, so what happens is they will drink Red Bull. Red Bull is very, very high in sugar and very, very high in caffeine. Okay, these 2 things together, you don't sleep. And then you got a lot of sugar. And then you're driving. And then you're sitting down. And then because you're 一直坐下来，你的脚 all the blood pools inside your legs. And a lot of them got diabetes because they always drink Red Bull. And so when you're always driving, your leg gonna cut. When you have diabetes, 讲这是我的脚板啦, okay, then drive lorry. So here it will start to get rotten. Okay, if the rod sets inside, they have to cut off their leg. That's why 糖尿病的人要割掉脚. So Red Bull is known as 割脚, the drink. It can actually cause you to have a heart attack and die. You're not supposed to drink Red Bull. Even people who go for ultra marathon don't drink Red Bull. So just because you're going swimming or going for a sports event, please don't drink Red Bull. Okay, it's very dangerous for your health. Antidepressant is for people with depression lah. Okay, antipsychotic is people who are gone mad already lah. So they give them something to calm them down. Okay, like a tranquilizer, barbiturat, doxepin, haloperidol. These are all medicines to calm the person down when the person is becoming very violent. Okay, Ken? Now,
Is Kenton stimulant?
yes, I think so. But that one is natural.
Just Kenton.
It's a kind of
And then local registration.
ketum. Is that illegal?
I think it's not illegal to plant. What's the illegal harvest?
No, it's a stimulant. And it can become a painkiller at a large. It's banned in Malaysia. You cannot. It's illegal. It's illegal for you to bring it in. Okay? Please don't bring after one day you come out in the newspaper. Okay. Shh. All right, now. So, complementary medicine. Do you know what is complementary? When you are sick, you go and see a doctor. Correct or not? Okay, but let's say 你每次去看医生 is not helping. What does your parents say? 去看中医. Correct or not? Or every time you go and see a doctor, your headache is still there, headache is still there. Then your parents say, go see acupuncture. So acupuncture and all these are not Western medicine. They are so-called Western medicine or medicated medicine. These are called complementary medicine. Okay? So example is acupuncture. Needles are poked into acupuncture points. Have you gone for acupuncture before?
Yes.
Yeah. Okay. Chiropractor is to realign the bones. Okay. Traditional massage is to relax the muscles. Okay. Homeopathy. Do you know what's homeopathy? Homeopathy is, for example, the person, he will get all the herbs, all the different herbs and give you. It's something like Chinese medicine, but not.
Which?
It's not witchcraft lah. Okay, it's like, I don't know how to say, like all the flowers and everything, this homeopathy lah. Okay, herbal therapy is your traditional herbs lah, like Tongkat Ali, that's herbal medicine. Okay, ginseng, that's herbal medicine. All right, but then you have to be careful. Certain things can cause side effects with modern medicine. For example, tom yum. If you tom yum, some of the real tom yum from Thailand, they put a lot of herbs. It causes your blood to flow better. If you're pregnant, you're not supposed to eat it because when you go for surgery, you cannot stop eating. Yeah, so it's not really something you can. Okay, all right. So this chapter is very, very easy. Okay, free radicals. Um, do you remember that time I was teaching you chlorine? Chlorine, okay. Chlorine got 17 electrons. Can you tell me what's the electron arrangement of chlorine? Think, think, think. What's the electron arrangement? Hey, don't look at me. What's the electron arrangement? 2? First shell, 2, second shell, 8, third shell, 7. Remember not? Do you remember not? I taught you all the atom, 287, 281.
8. Maximum is 8. The first one minimum is next
2.
Yeah.
Does this look familiar?
Yes, very sure.
Everybody wants to achieve 8, correct? Not? If you gain electron, you become negative. If you lose electron, you become positive. So this one is 287. So it's very unbalanced. So what it will do is it will go and find another chlorine and it will exist as a molecule like that. It's happy. Okay. 可是 sometimes this will become free. 如果它一粒这样 become free, they are very, very reactive, very, very reactive. Okay, 它是吵死人的人。So 吵死人的会感召人还是会感召人？会感召人呢 That's what a free radical is. A free radical is a chemical that will go and break up another chemical. Okay. Free radicals are atoms or molecules that lack one electron, which makes it very unstable and reactive. Example is chlorine atom. Chlorine atom is 287. They just need one more electron. So because they need one more electron, they become very, very reactive. Okay, so they will go and attack every single cell in your body where there's a lot of free radicals. So what kind of disease can they cause? They can cause infertility. Infertility means what? 不可以生 baby, yes. Okay, damage to kidney, liver, and lungs, premature aging, including wrinkles and gray hair. Okay, so it will harm your DNA. These are called free radicals. Where do you get these free radicals from? From chemicals, from hairspray, okay, from chemicals, from hairspray, from you burn petroleum, all those are free chemicals, free radicals. Okay, so they will harm your DNA. So examples of free radicals, okay, radiation, toxic waste, air pollution, UV ray, and cigarette smoke. Okay, so if you're always in the sun, 你没听过人家讲你 always in the sun 你会很多皱纹, right? It's because the free radicals are produced under ultraviolet rays. Okay, can. All right, last one, antioxidant. I'm sure 你买过 facial product 都有写 antioxidant.
Well,
Okay, when you cut an apple in half, the apple becomes brown. The apple becomes brown because the oxygen in the air react with the apple. That is called oxidation. Is that good or bad? Bad. So when you want to stop oxidation, you use the antioxidant. 如果你不要你的苹果变成 brown color, what do? 你放什么？盐 or you can put lemon.
salt.
Have you heard before you put lemon? Okay, so lemon is an antioxidant. So all these fruits, anything that is colorful, anything that is fruits and vegetables are high in antioxidant. So they slow down the process of aging. They slow down the process of oxidation in our body. Okay, can? Vitamin C, vitamin E, lycopene, lutein, and beta carotene. Okay, so these are all good for preventing oxidation. Okay, all right. Can you please look at your notes? Okay. So, traditional medicine, do you remember what I taught you just now? Ginger. What else?
Juice,
Ginseng,
hibiscus flower.
hibiscus, aloe vera. What are the three modern
Antibiotics.
antibiotics,
Just
analgesics, analgesic, psychotherapeutic, psychotherapeutic drugs. Okay, that's three. Okay, complementary medicine, there is acupuncture, there is chiropractor, there is traditional massage, there is homeopathy, and there is herbal medicine. Herbal, homeo, okay, and then there is acupuncture, okay, and then there is chiropractor and traditional massage. Okay, done? Right around ready? Okay. All right. Okay, free radicals, atoms or molecules that lack one electron that make them unstable. Antioxidants are natural to neutralize free radicals by donating their electrons to compensate for the radicals electron deficiency. So when you eat coloring, you're eating a lot of free radicals. When you're eating cheeses, it's orange. So you must eat an actual orange to neutralize the free radicals in the cheeses orange. Okay? Okay? So it's really, really bad. Okay? Health products. Okay? They have active ingredients that help to prevent diseases. All right. Okay, can you try and do this based on what I just taught you? Okay. Which uses natural substances of animals and plants? So X. Why is X still relevant?
Most.
Okay, so people still sort it out because it's natural, less side effect, it is effective, proven to be effective. Okay, less side effects, proven to be effective to help prevent and manage disease. Okay, what's the difference between Y and Z?
Oils.
Y uses synthetic. Do you know synthetic? Synthetic means man-made. Okay. Synthetic medicine.
Okay, just
Man-made. Okay lah. Okay. Uh, while while Z uses natural substances. Okay. Y uses surgery or laser treatment. Z uses a natural product.
Why is clinically
Y is what?
proven?
But Z, Z also clinically proven ma. You cannot say chiropractor or or acupuncture is not clinically proven. It's clinically proven to help with pain also. Right? Okay. Ready? Okay, have you done this? Can you do 2, 3, 4? These are all things that I've taught you. Very easy, very, very easy. You can do it in like 5 minutes. Yeah, I know it's very sleepy. It's the heat. Okay, guys done? Guys done? So done that you're sleeping already. Okay. If you don't know, this one is hibiscus. We all sit down and cry, okay? Alright, so hibiscus. This is hibiscus tea. Huh? 没有味道的. It's a bit 酸酸罢了. All this is like natural teas. They got no caffeine. They got no sugar. It's just a bit sourish. Okay. This is ginger. This is garlic. It's to ward off what? Vampires. No. Okay. So garlic lowers high blood pressure, but actually garlic also helps to kill bacteria. Okay. It's very good antifungal, antibacterial. Okay.
Tamarind.
Okay. This one is tamarind. This one is turmeric. Turmeric is a very famous anti-inflammation, antioxidant. Okay. And this one is the only one that is not available, the last one. Pegaga. Cantilla asiatica. It's a kind of, it's a kind of herb.
Ulang.
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 Yeah. Apparently. Okay. All right. This one is analgesic. How you know? Because I just told you. This one is antibiotic. And this one is psychotherapeutic. Okay. All right. Paracetamol. Who else? Aspirin. Codeine. Okay. Antibiotic is penicillin, streptomycin. Of course, there's other types lah. Okay, so there's stimulant to make you wake up and uh, antipsychotic to make you calm down. Okay. Okay. Uses his hands to adjustment. So what is this chiropractor? Okay. Chiropractor uses his hands to make adjustment to the uh oh sorry. This is chiropractor. This is chiropractic. Okay. Adjustment to the spine, bone. Okay. Acupuncture, a method used to stimulate the Nervous system, nervous system. Have you all? I've tried. So one time, apparently, I was lying down. He put a long needle into my back. I didn't see it because I can't feel it, ma. But my friend said he saw like a lot. She saw because she said, because the guy asked me, "Is it pain?" I said, "Yes, this is the part. It's pain." Okay, now, then I was like, then after that, she's looking at it. She's like, "Taylor." Later, when the guy asks me, I'm going to say not pain, so that he won't poke me that side. It's like long, you know. Okay, so a method to stimulate the nervous system to relieve pain using sterile needles.
What does sterile mean?
Steriles mean you 消毒.
Ah,
So you use either nowadays they use the one that is in a packet new one, or you boil the needles. But nowadays people don't boil. People use one time use only. One time use then 丢掉, one time use and then 丢掉. Okay. Okay. So herbal therapy. Okay. Uses plants or parts of plants that cure diseases. Traditional massage uses uh
no, no, no.
to smooth blood flow to relieve pain. Okay. Cellulitis is a skin disease caused by bacteria. Cellulitis will cause the skin to become red, swollen, hot, and painful in the affected area. So it's caused by bacteria. Okay. Shows the medicine used to treat the disease. Okay. State the benefits of both medicines to treat the disease. Okay. How is antibiotics good? Antibiotic will kill the bacteria that causes the disease. And then how is aloe vera good? Aloe vera will soothe the skin. Okay, so if ever you got burn or anything, you put aloe vera, it will help to calm it down and soothe the pain. Okay, so aloe vera soothes inflammation on skin and moisturizes the skin. Okay, biotics will kill the bacteria is causing. In your opinion, which medicine is most suitable to reduce swelling and treat cellulitis? Give your reason. Okay, which one is more important, the antibiotic or the aloe vera? Antibiotic. Because like aloe vera, if it's calm already, but the antibiotic is still there, it will flare up again. When you kill off the antibiotic, eventually the flaring off will stop. Okay? So antibiotic. Only suits the symptoms without treating the infection. Okay. All right. Okay, this one no need lah. This one no need. It's not right now. Okay. Antibiotics. Okay. Now, there is something called superbugs. It's called antibiotic resistant bacteria. Antibiotic resistant bacteria. That means 那个 bacteria so strong that 你吃多少 antibiotic 都不会死的。为什么会这样？Okay, let's say 这个是一个 family of antibiotic bacteria, sorry，这个是 bacteria 啊。你知道什么是 mutation 吗？有听过这个东西吗？mutation is 以前我教过你们为什么会变 Down syndrome，为什么会变这种 genetic disease 是 suddenly change。So bacteria 这些是 bacteria 也是会 suddenly mutation 的。So 这个是 mutated bacteria。OK，这些全部的 bacteria 都是 normal 的，只有一个是 mutated。这个 mutated bacteria 有什么 special？The mutated bacteria cannot be killed by antibiotics. OK, however，如果医生给你吃 antibiotic，你把你的 antibiotic 吃完，虽然这个不会死，可是它只剩一粒，they cannot do much. It will eventually die off. Okay, because bacteria need a colony to live. Okay, but but 如果这个是那些 antibiotic 这只是那个 bacteria，你吃 antibiotic 医生给你5天 antibiotic，你要吃几天？5天。有些人吃第一天、第二天、第三天，诶，好了，不用吃了。That is very bad，因为你吃第一天，你吃第二天，你吃第三天，你就停。这里还有，Now here's the problem，它这里还有它这个就不会觉得寂寞，它就会 reproduce。现在第二次的时候比较多 mutated 还是比较多 normal mutated，then 又多几个礼拜、几个月，这样你又生病你这次又吃 antibiotic，吃2天又好了，你又没有吃2天好了你又没有吃，then what happens now? The one that grow back very very fast is the mutated，因为它有 gang 了嘛。现在第三次你中一样的 bacteria，你吃多少 antibiotic 也是不会好的，因为已经 mutated。So 如果你没有生病 no bacterial infection，不要乱吃。Number two，如果医生给你吃，一定要吃完，不可以吃一半的。第三 is because we eat a lot of chicken and animal product, they are sprayed with a lot of antibiotic. So all our food system got antibiotic. Okay, can you understand? All right. So can you try and do this part, this question? So this is called how you make antibiotic, how it becomes antibiotic resistant. Who can pass to Azhar? Can I trust you all?
是
You're the only one I trust.
中央红吧。
Okay, I will give you antibiotics. Please make sure you complete the full course of antibiotic as prescribed. Okay, what is the function of antibiotics? To kill bacteria. Okay, antibiotics are drugs that need to be finished completely, even if the patient is already feeling better. What is the effects of the course of antibiotic not completed? Antibiotics that are not finished according to the doctor's prescription may cause the
Yeah.
bacteria not to be completely killed and become immune or resistant. Also can. Okay, this may be result in the patient needing a stronger dose. Okay, can you just keep giving stronger and stronger antibiotics? Because your kidneys will fail. Okay? Tina receives advice from her doctor to take medication according to prescription. What are the consequences of Tina misusing the medication? Okay, causes addiction. But that's only painkillers. Not everything causes addiction. You cannot get addicted to Panadol, okay? Causes severe uh, side effects. Some vomiting lah, diarrhea. Okay? Okay, can cause death. Okay? What is free radical? Are from atoms or molecules that lack one electron, which make the atoms or molecules unstable. Okay? And tend to combine or react or attack. Okay? They are unstable, comma, reactive. Okay? So you actually don't want them to react with you, but they keep attacking your cells. Free radicals produced from the oxidation process that occur naturally inside the body, which a substance loses its electron. This situation triggers a chain reaction. Do you know what's chain reaction? Free radicals 不是一粒罢了，那个一粒它就会 then after that will become more and more free radicals. Okay? Alright. Mark tick on the external factors that produce free radicals. Okay? Ionizing radiation and toxic waste. Metabolism, no. Okay. Internal factors that produce free radical is metabolism and inflammation. Do you know what's inflammation? Yeah, 发炎. Inside got a lot of inflammation if you're sick. Free radicals can form carcinogenic. What's carcinogenic? Carcinogenic causes cancer. Free radicals can eventually cause carcinogenics. Yes. Which one? Which one? It's too fast, let me know. I know this. Okay. Free radicals cause premature aging, yes. Free radicals causes the body's metabolic rate to be higher. No, wow, free radical 就可以减肥. No, no, no. Infertility can cause as a result of free radicals, yes. Cannot have babies, yes. Okay, Ken? So you see this one is 2,8, so it's stable. This is 2,7, so it's unstable. So the antioxidant makes it stable again. Okay? Chemical substances are needed by our body to slow down or stop oxidation. Okay, so antioxidants complete the lack of electrons processed by the free radicals by donating their electrons to the free radicals, thus stopping, sorry, the chain reaction can stop. Is it done? Oh, yes. Okay, can you finish this now? Two, finish all this. You do it now, then we discuss next week. Okay, you do it now, do it now. Because I know you go home, you won't do one. Do it now, do it now. Okay, you guys can go home and finish it. Please finish it. Please don't lose the paper. Okay. Um, can you please let me know your final exam is until where? Everything, ah?
Not sure. I think it's everyone. I don't know.
Okay.
Everyone.